Hello, I'm Dr. William Zoghbi, Chair of Cardiology here at Houston Methodist and the DeBakey Heart and Vascular Center. I'd like to welcome all of you to the first annual Houston Methodist System Congenital Heart Disease Awareness Week. During this series of videos, we will talk about some of the most important points that all of us in healthcare need to know to care for this rapidly growing population of patients. With me is Dr. Huie Lin, Director of the Adult Congenital Heart Disease Program.
Hi, thanks for having me.
Huie, it's great to have you. I understand that about 1% of the population has some form of adult congenital heart disease.
That's right. What's really incredible today is that a child born with congenital heart disease has a more than 90% likelihood of surviving to adulthood.
So that's really quite remarkable and quite a progress over the years to be able to do this. So if we are dealing with 90% surviving till adulthood, we should have a lot of patients in the United States with adult congenital heart disease in the Houston area.
We think that there's somewhere around 2 million adults with congenital heart disease in the United States at this point. So many, many more than pediatric patients with congenital heart disease.
So if it is 2 million, do we estimate about 40,000 or so would be in the Houston area?
That's right, that's right. And in fact, we may actually have more than that in Houston because of the rich cardiac surgical history here in Houston. So for example, in our practice, we have patients who are as old as their 80s with very complicated congenital heart disease, which is really a testimony to the success that's happened here in this city.
Well, that's amazing. So in addition to that, the beauty that many of these patients survive to adulthood and live well to adulthood, there's the other issue of pregnancy in adult congenital heart disease. Tell us about that.
That's a very important point. What we're finding now is that if a patient is well managed in collaboration with an adult congenital heart program, many of our patients can not only become pregnant, but they can carry out a successful pregnancy with careful monitoring and maintenance throughout their pregnancy.
Well, I'm very happy that Dr. Valeria Duarte has joined our team. She specializes in adult congenital heart disease and pregnancy. And we've had several successes over the past year or so. Tell us about that a little more.
That's right. It's really exciting that we actually have a situation now where we have a number of healthy babies and healthy mothers coming into the program. So it's quite remarkable that with a specialist like Dr. Valeria Duarte that we can take care of these patients with very complicated congenital heart disease through a pregnancy that would otherwise be very, very challenging.
Well, I think so. The most important messages, one is patients with adult congenital heart disease, some of them are complex, need to be seen by specialists in adult congenital heart disease. And the second message is pregnancy, right? Pregnancy and heart disease and adult congenital heart disease. So I think these are very important messages to our colleagues and friends in the Houston Methodist system. They collaborate with us on so many areas, and particularly for areas of adult congenital heart disease, the primary care physicians, as well as the adult cardiologist.
That's right. And so one of the things that we're really trying to emphasize during this week, where we're emphasizing awareness around congenital heart disease, is that if it affects 1% of all live births, that means every single one of us probably knows somebody who is affected by congenital heart disease, whether it's our colleagues, our friends, our loved ones, our neighbors. And so really getting out the knowledge and the awareness that it takes a team of primary care physicians in the system, and really the strength of the cardiologists within the system, working with the adult congenital heart program, that we can really be successful in taking care of these patients.
So I can imagine this is really one of the best times in the history of adult congenital heart disease to have this disease and live well with the disease with the specialists that we have in adult congenital heart disease. So this is kudos to your team, kudos to all the people involved in this program. And I know that you've applied for accreditation, and I know how much that is meaningful and hard work, but I think this is very important in the care of patients with adult congenital heart disease. Congratulations.
Thank you.